And it is my pleasure to welcome again Mr. Germán Gutiérrez to the stage that will conduct a debate with representatives from 4 European countries participating in the project. So go ahead, Germán.
Thank you, Ainhoa. And now it's my pleasure just to introduce what I consider a very important session for this morning, that is about European administration strategies in the active and healthy aging field. And why is it so important? Because in reality, the ACTIVAGE project has been designed from the very beginning to have an impact. And impact is about scaling up our initial results in the pilots to the real life, to what is going to happen after the project. So we are going to develop this roundtable, starting with Mrs. France Lamotte, that is coming from the Autonomy Director at LICER Department in France. And in this case, she will participate through a recording. And the question is quite simple, is the question. Which are your strategic plans for providing active aging services at large scales in your region? And this is going to be the same question for all the panelists. So we are going to start with France, and this is the recording. Thank you very much.
First of all, we have already launched active aging innovation in our region. ACTIVAGE has been initiated to complete and strengthen our ISERADOM approach in ISER. As a reminder, ISERADOM is a set of digital solutions and home organizations which allows an articulation of human and digital aids, the identification of weaknesses in order to adjust the care services and avoid hospitalization or avoid loss of autonomy. We have made this process a sentinel process. In ISERADOM, there is a digital linked notebook and operational processes for care workers on the point I have just mentioned. ACTIVAGE provided a complementary solution with home automation sensors. They are used to identify weaknesses. The data from the home automation sensors are provided to the care managers to analyze the needs. ACTIVAGE provided study of sustainability of home automation's offers, how to disseminate this type of offer, and how to finance it. Thus, thanks to ACTIVAGE, we have made the demonstration that home automation is useful for identifying the frailties of people with loss of autonomy. This is panel 2. But it is interesting for retired people because that satisfy comfort and safety needs. This is panel 1. And it is useful for nursing staff to assess the patient's ability to return home after hospitalization. This is panel 3. Now, what is the next step? The deployment of large scale is ongoing, and it is considered in 3 stages. The first step is to consolidate and deploy ISERADOM at the ISER level, within the framework of the public policy and funding for care plan. The second step is to mutualize ISERADOM investments with other regions to lower costs and improve the national framework for care and sentinel monitoring. The third step is to gradually integrate connected devices like home automation sensors into the care plan with digital interface with the digital link book. The vision that we keep is that digital innovation must be a complement to human assistance. It is necessary to work on operating methods that allow the articulation of human observation and the feedback of data. In the long term, the connected devices will be used, but the priority now concerns the deployment of digital solutions like the digital link book. To have traceability of every weak signal about needs or frailty from caregivers, we must modernize this process before the use of sensors. A local but also national policy. Okay, I repeat, sorry. A local but also national policy is necessary to support these innovations that are more social than technological within the framework of public policies. A private offer has to be developed for retired but dynamic people with home automation sensors for comfort, security, or thermic efficiency, but with the same sensors used in care plan to detect weak signal. This is the end. Thank you very much.
Okay, thank you very much. This has been, I think, very clear perspective of what is these plans in this region. And we would like to continue with Mr. Rudolf Blank, that is the CEO of Assisted Home Solutions and consultant for the Bavarian Red Cross. So same question, same ambition. So the stage is yours.
First of all, I would like to stress that together with our site operators in ACTIVAGE, that is the Bavarian Red Cross, Johanniter and WBG in Mindelheim, we are in negotiation the next steps in terms of upscaling and replication. These are concrete plans for new sites to equip with our solution, and B, including our control in their emergency call program as alternative control. On this basis, I would now like to answer your question more with my head as Managing Director of Assisted Home Solutions, which is more a commercial perspective. The first point is the politically. Participation in the discussion on the extension and the aids paid for by the long-term care insurance with the keyword digitization. The Federal Council in Germany has tabled a resolution to promote digitization in the care and furnishing of apartments with IoT AHA. At the same time, long-term care insurance companies were asked to organize the assumption of costs of such schemes by the long-term care insurance. This is a politic new in German politics. Second point, the product. Our product, we develop the system with the knowledge gained and make it marketable. The findings from the project will be incorporated into the software even further than rules and technical developments. We had defined categories for nursing homes. There's a special version for installing in nursing homes. They are integrated into existing call and telephone systems and allow the nursing staff to intervene immediately if, for example, a resident at risk of falling gets out of bed, leaves the room, or doesn't return from the bathroom. This is particularly important in pandemic times because contacts between nurses and residents have been minimized. Here we will be strongly committed to offering the system to nursing homes. Second point of categories for products is supervised residential complexes. Supervised residential complexes are barrier-free apartments whose apartments are usually supervised by the hour by carers, concierges. Especially outside these times of the presence of carers, our system is important and valuable because it gives the residents a security that was previously unrepresentable in such forms of housing. To this end, we present the system of housing associations, investors, and support providers. Third, the private apartments. We are in the process of developing a system as a plug-and-play version. As an assisted living, the system can automatically detect emergency situations and contact auxiliaries without the occupant having to take action. A special feature is that in the event of an alarm, we can securely open the apartment door without the helper having to have an apartment key. the system can be removed without much effort and can be reused elsewhere. In doing so, we are raising what has been established in Germany for decades as a home emergency call to a new level, unprecedented, a quantum leap, so to speak. To this end, we present our system to the established home emergency service providers who serve more than 500,000 customers in Germany. And we're preparing the series production. After completing the development and prototype phase of the project, we will be preparing series production with suitable partners from the end of 2020. And the high point is advertising and marketing. At the same time, we plan to target potential users. This is a target approach to first nursing home operators, operators of nursing homes that are being renovated or newly built their houses. Here we try to install our system firmly and integrate into the further technical infrastructure, for example, call system, telephone system. The Bavarian Red Cross, as our partner, already operates more than 100 nursing homes, so we are already in talks to equip further facilities. So home emergency call provider. Here we focus on the operators of the call centers, German Red Cross, Johanniter, Malteser, and so on. In this way, we reach a wide range of potential users. The Bavarian Red Cross and the Johanniter, as our partners in the project, looked after well over 50,000 elderly people with the home emergency call of the previous kind. We do not sell directly to end customers, as assistive technology must be always accompanied by services provided by people. The second point, housing associations. In Germany, in the last time, more and more investments are being made in floor-to-story apartment constructions. At the same time, many residential builds from the 60s and later have to be renovated. Often the houses with the inhabitants have grown old, so that our assistance system becomes particularly valuable here to enable a permanent self-determined life. Here too we have a partner in the project with the WBG in Turkheim, which looks after about 1,000 apartments and is well connected with other public housing associations and cooperatives. And for real estate investors, called private investors, also increasingly building multi-family houses, this is often the higher price range. Here our systems come into play not only from the point of view of self-determined, of safe living, but also from a comfort point of view, an example for controlling blinds, light, heating, and so on. And our target for 2021 is purchase contracts for 5,000 systems close. One opportunity for us is policy at national and federal level to promote the digitalization of care and self-employment, for example by requiring long-term care insurance to reimburse costs for the use of the IoT solutions. With the confidence we have gained from our ACTIVAGE experience, an important goal for us is for our solutions to become an official model for the ability to recover IoT solutions. In addition, we aim at framework contracts with our customers in which organizations such as Bavarian Red Cross and so on reserve a larger number of our controllers in advance. An important milestone is to reach the number of at least 5,000 pre-orders to the end of Q2 2021. Thank you.
Thank you very much. Well, it's really incredible the number of activities, and I'm happy to see that Germany is really scaling up all this strategy. And I'm curious to see if there is the same level of traction with the same of the participants. So their experience is somehow linked to what you have said. So we also have Mr. Carlos Kapat, Digital Technology Services Director at Red Cross Spain. And we are really curious to hear your perspective and if it is connected with the participant that have just provided their input.
Well, firstly, thank you so much for giving me the opportunity to participate in this panel, in this session. And ACTIVAGE project really gave us the opportunity, and that was very important to us because it has enabled us to really provide a service that for more than 30 years we've been providing, but to do it in an even better way, and we reach 160,000 people. So what's the difference? Thanks to ActiVage, we can identify new cases of use with this technology, with these capabilities. For instance, in addition to people who live on their own, it's also enabled us to provide this service to people who are living in shared flats and supervised by the public administration. Also, for people, a case of use that we could never imagine would be necessary, migrants, immigrants from other countries, other parts of the world, mostly North Africa. That's how they enter Spain. And they live in residential apartments, and they need to be supervised, and they need this assistance that we provide at the Red Cross, and the administration also is supervising their social and health care. Another use, unfortunately, is for people who, due to the loss that they've suffered from the pandemic, they've lost someone, and they maybe have reduced mobility, and this has been the case more so in the community of Madrid. Additionally, we have included this also as a service in a project that we have identified as therapeutic assistance. This is run by other departments, the health department at the Red Cross. We have 144 users and 11 regions in Spain. This is a little bit what we've been doing so far. It's true that, on the other hand, we have thought of providing this direct access to these services through citizens who wish to pay or finance these sorts of services. And so we have increased in our services portfolio, let's say, chronic patients, caretakers. So we have packaged different levels of service in something we call Take Care of Yourself. There's 3 levels, then there's the plus or premium, and then there's the global one that includes everything. We do this by disseminating on social media, and that's where they need to, carry out that economic investment. And some people are calling a telephone number, 900 number, and the operator will answer their questions so that they can contract the service. Currently, and as of October 1st, 2020, this service is being used in total by 584 people in 46 different regions of Spain. That's our reality. We haven't waited for the project to finish to launch it. It's already rolling, it's in motion, and it's serving in very imaginative ways, such as supervising housing where we have immigrants living.
Okay, thank you very much, Carlos. I think it is really interesting, this approach of citizen engagement and financial self-sustainability with these kind of programs. So very, very interesting, just for assuring the continuity of these type of services. And I think we have Elena waiting, Mrs. Elena Rocher, Health Program Officer in Las Naves, Valencia City Council. And we are really curious about hearing your perspective about large-scale deployment in your region. Elena?
Okay, yes, hello, good afternoon. Thanks for inviting me to participate in this panel. First of all, I would like to explain the context where Las Naves act and how can we can influence or shape public policies to scale up the ActiVage services. Okay, Las Naves is a foundation promoted by Valencia City Council, and our aim is to promote social and urban innovation within the city by testing innovative solutions that tackle with real needs of population, generating evidence and assessing the results and evaluating these innovative solutions to see if it's worth to scale up as new public services. So this is the framework where Las Naves can act to scale up services such as the ActiVage services. Now, and that's the reason why we engage in this passionate and exciting project. On the other hand, we have the current context of elderly population in our city. Nowadays, we have around 21% of population are over 64. That means around 168,000 people, elderly people in the city. And by 2033, this percentage will increase to 25%, and we will be talking about more than 200,000 older people in the city. And if we consider the Valencia region, we will be talking by then about more than 700,000 older people in the region. So this is a key priority to act from the public policies in our city and in our region. We have been working in the last months and all around the project, or through the project, to be honest, to see how we can scale up the services we have been testing. And we have the limits of our own competences as an innovation foundation, and also because we have as you know, the public sector procurement law that has some barriers and to scale up this kind of innovative solutions. No? So I think I have to remark that as one of the main milestones achieved is that ACTIVAGE services have been included in the municipal post-COVID reconstruction plan for the city of Valencia, and one of the measures that in the next 6 months the city council has to implement. And the objective is to reach with these ACTIVAGE services 5,000 users. So we have here a first milestone of this scaling up the services. And this plan was approved by all parties of the local government in last month of July. On the other hand, we have another tool, which is the innovative public procurement that we are going to use for the scaling up of the ACTIVAGE services. ACTIVAGE services are going to be analyzed as case study to engage an innovative public procurement process within the city council, and in the framework of a grant that has been awarded to Las Naves from our regional innovation agency. So the third line of work we have been developing is to transfer the results of the project to the current existing municipal home healthcare services to be included in future tender processes. I mean, to include these results of the project in the future tender processes of teleassistance, for instance, or the home care service. And finally, but not least, less important, at the end, this is the objective of the foundation is we are trying to shape the future public policies. Because Valencia, you may know, is currently engaged in a governance process led by Las Naves and the Innovation Municipal Service for the definition of the missions for the period 2030, and these missions will guide the research and innovation strategies to improve people's life for a healthier, more sustainable, shared and entrepreneurial city. And beyond the topics we are considering to define the future missions, we have a clear one, the longevity and active aging. This is one of the areas of relevance where we will have to define missions, concrete missions, to develop the city as a healthier city. So in the future, projects, grants, prizes, awards, any kind of public policy tool that we launch from the city council will have to focus on the development of this kind of services that tackle with the challenge or the area of relevance of active aging. So this is what we are now engaged and trying to promote and to carry out.
Yeah.
Thank you
very much, Elena. What I would like to remark in your contribution is the importance of readiness, to be ready. So you probably are in the front line of the response to the COVID-19 in Valencia because you were ready. You were actually ready with thanks to ACTIVAGE. And also because you are ready, you are present as consultants for the future plans of the region. So congratulations.
Thank you.
And well, our last panelist is Mr. Odysseas Raptis, a board member of CitiesNet SA, Digital Cities of Central Greece. So, Odysseas, the stage is yours. Same question, same challenge.
Thank you very much. First of all, good afternoon from Trikala, Greece. And worth to say that it's an honor for us, for me, for the company to participate in this panel. To participate and explore actually the IoT contribution to improving the standards of living. And as everyone has explained before, is that we are trying to improve the living standards for elderly people. In Greece, we have another phenomenon which might assist a lot the technology, and actually that has been partially proved by the ACTIVAGE program. We have mountains that there are villages that are isolated, mainly during the winter time, and consider that Greece has over 2,000 islands, big and small islands. And in all those places, there are people living there. So the healthcare and the social care, if we combine those two things and we name it telecare, is something very, very important. And that has been already proved by the last 10 years that Citizen and Trikala, the municipality of Trikala, are working with the European community in improving the technology and bring the patient, the inhabitants, very closely to their doctors or closely to their relatives. First of all, the municipality enterprise CitizenNet is the municipality of, it consists of 10 municipalities of central Greece, the mainland, with a competence center located in the municipality of Trikala that I am located today. We have deployed the ACTIVAGE project in 6 different municipalities and disseminated the service in more than 10 municipalities that are members of the enterprise CitizenNet. Actually, it was challenging to deploy this pilot in so many different places around Greece at the same time. However, the impact of the project has rewarded our efforts, as I explained before. Part of the exploitation plans is, and it was and is still, to explore the possibility of coming to an agreement with one or more of these cities as to continue the ACTIVAGE service after the end of the pilot. And I have to remind you that Greece was and is still under the economical crisis. But you see that after the results that we have retrieved from ACTIVAGE, and after the contacts that the mayors had with our people that have been serviced by the ACTIVAGE project, they are optimistic and they are wondering and they are asking whether we can explore the service or how and what is the tool, what are the tools from, let's say, European finance on the national finance to install more and more devices in the house. What we have done with ACTIVAGE in those municipalities is that we had, first of all, we had a small, according to the numbers that I heard before, we had a small target. That was the budget. It was for 150 houses. And we have finally employed 113 houses. The point is that we have to explore. We have to assist the municipalities to transfer that option, that IoT application, IoT technology, to transfer that to a service, to a constant and everyday service, so as to build a center to welcome all these, let's say, information or signals that are coming from their houses. We have employed the detection sensors in the houses, and on the second part, we had the blood pressure measurement and blood sugar measurements during this project. Both were optimistic. Both we are sure, and that came out after the questionnaires, that they have improved the everyday living standards from all these people, but especially from their relatives. People that are accepting to use the technology are people that have not the driving license, or they're not easy for them to move. So you understand that there are relatives that they have to serve or they have to pay to move, and by this they're feeling secure that they have somebody to take care of them if they're falling down or if they are not following the formal, let's say, everyday procedure. To conclude, municipalities are interested in Greece. Thanks to the ACTIVAGE, thanks to the consortium and the technology, thanks to CERT that we are working together to implement this project, they are ready to follow and to continue the project. Regarding the COVID-19, as everybody know, we had lockdowns in Trikala, lockdowns all over Greece. The IoT telecare service for elderly during this COVID-19 lockdown, it was not only welcomed, it was a solution. It was a solution because they had no the opportunity to go to their doctors, to drive to their doctors, to walk to their doctors, to, let's say, get the every week or every month measurements. So we still have letters from our people that we have served, letters and their relatives writing to the mayors that we have to continue on this. Having that in mind, that there is currently a second wave of pandemic here in Greece, both services could become a part of each municipality's strategic approach. What we have to do with the pandemic is to leave IoT to help and assist all these members, all these people. That's it from Trikala. I don't know if you want to ask me something more, but I think that that was a successful, a very successful application, and the society is still happy.
Thank you, Odysseas. Thank you to all the panelists for your contribution. Not a question, but I would like just to make a final remark. This question was the very same question that we made at the very beginning of the project 4 years ago. To health administration, to social administration, to politicians, and the answers were very generic. I think the main difference to what we have heard today is that these answers are much more concrete, much more tangible, and demonstrates that this is a growing need, and we have solutions that we have already developed within ACTIVAGE and will condition how administrations are going to react to this challenge of aging population. Of course, pandemic is an accelerator, as we stated at the very beginning, and I think, well, your contribution and your comments are really clear on the importance of what we are doing in this project. So thank you very much. Thank you very much for your contribution, and we continue the show. Thank you.